Hello everyone, myself Preeti Mandal of Group Ladin 192B is going to present a conference presentation on the topic Kaposi sarcoma. So before discussing what Kaposi sarcoma is, what does Kaposi sarcoma looks like? It is generally pink brown reddish purple spots which appears as patches, raised or bumps. What is Kaposi sarcoma? Kaposi sarcoma is a vascular endothelial multifocal angioproliferative disorder or preferred mucocutaneous location with potential to reach internal organs. It was described by Maurice Kaposi as idiopathic multiple pigmented sarcoma of the skin in 1872. Kaposi sarcoma is vascular neoplasm caused by human herpes virus 8. It tends to be indolent, that is silent, and but may be locally aggressive. It is multifocal systemic disease with 4 clinical variants and 3 stages. Clinical variants are: first, classic or sporadic Kaposi sarcoma, which tends to appear more in elderly men than women, appears in lower extremity skin lesions, and occurs in the region of Central Equatorial Africa, Mediterranean, and Eastern European, may be associated with secondary malignancy, which is clinically indolent course. Second one is endemic or African Kaposi sarcoma. It generally occurs on lower extremity skin lesions. Children and young to middle aged adults are mostly affected. It is not related to HIV. It occurs in the sub Saharan Africa region. It may be aggressive if lymph nodes are involved. This picture depicts the endemic Kaposi sarcoma. Iatrogenic Kaposi sarcoma. It is predominantly transplant associated. Patients older than 50 years are involved. By excessive use of cyclosporin A, it occurs. Skin, visceral, and mucosa are involved. May resolve entirely after withdrawal of immunosuppressive treatment. AIDS associated Kaposi sarcoma. Patient infected with HIV-1. Predilection for certain risk group. Risk for homosexual men greater than hemophilic. Affinity for skin but may be disseminated. Most aggressive of all Kaposi subtypes. Clinical stages. There are mainly 3 stages: patch stage, plaque stage, and tumor stage. Or all 4 clinical subtypes of Kaposi may show these stages. Multiple different stages may be present simultaneously. Patch stage. Patch stage of Kaposi sarcoma, in it is there is increased vascular spaces in reticular dermis, scattered lymphocyte and plasma cells. In this slide, we can see patch stage Kaposi sarcoma showing newly found vessels protruding into a larger vascular space characteristic of the promontory sign. In this slide, we can see some illustrating lymphocyte at the top right, an aggregate of plasma cell in the bottom right, and dilated vascular channels of Kaposi sarcoma are also easily identified on the top left. Plaque stage. In the plaque stage, we can see blood vessels surrounded by endothelial cells and spindle shaped cells with atypical nuclei and inflammatory infiltrate. Plaque stage of Kaposi sarcoma. More extensive vascular proliferation, dense inflammatory infiltrate, hyaline globules representing destroyed erythrocyte may be found. In this low magnification, we can see dense inflammatory infiltrate. And in this higher magnification, we can more clearly see lymphoplasmacytic infiltrate. Nodular stage of Kaposi sarcoma. In well circumscribed cellular nodules, intersecting fascicles of spindle tumor cells and numerous mitosis can be seen. In the first picture, we can see Kaposi sarcoma in a patient with acquired immunodeficiency syndrome, erythematous villous plaque on the tip of nose, corner of mouth and the left cheek. In the second picture, we can see classic Kaposi sarcoma on the leg, erythematous brownish plaque on the leg. In this picture, we can see multiple erythematous violaceous exophytic nodules of different diameters located in the inflammatory region and left flank. In greater detail, ulceration on the surface of one of the nodules. Tumor or nodular stage. Discrete nodules composed of intersecting fascicles of uniform spindle cells. In this, we can see blood-filled spaces between spindle cells, such as slit-like spaces and sieve-like spaces. This slide depicts sieve-like pattern. In this slide, we can clearly see a by broad arrow represents the bland tumor cells containing uniform spindle nuclei. Despite the lack of atypia, mitosis are easily found. In the narrow by the narrow arrow, we can see small sieve-like spaces containing erythrocytes. Slit-like vascular spaces formed by spindle endothelial cells with minimal to moderate atypia, hemorrhage, hemosiderin, and plasma cells are key histological clue for the Kaposi sarcoma. Can histologically mimic angiosarcoma. Distinction is very critical as behavior and treatment are very different. This slide depicts slit-like spaces. In the slide, we can see hemosiderin deposition in the upper middle of the slide. We can see blood-filled channel which is present. So, all stages, mitosis common but pleomorphism usually minimal. Plasma cells present in most cases. Yes, and we can distinguish the Kaposi sarcoma from angiosarcoma mainly through immunostaining. Immunostaining for human herpes virus 8 latent nuclear antigen 1 helps distinguish Kaposi sarcoma from its mimicker. Treatment of Kaposi sarcoma: immunodeficiency medications, surgery, radiation, and highly active antiretroviral therapy could be used. Chemotherapy, radiotherapy, cryotherapy may be useful. Surgical approaches could be seen. Thank you.